Hello and welcome. Grief therapist Carolyn here. I'm the founder and director of the Center for Integrated Grief. This video is the first in a three-part series about how we conduct our assessments or initial evaluations here at the Center for Integrated Grief. I wanted to give people an idea so you knew what to expect. To help people feel more comfortable. Some people have never been to therapy before, or some therapists do things a little bit different. Please note that the third video in this series is going to be for everybody. These are my cards, so I don't forget anything. The third video is going to be for everybody who comes to us. Not everybody comes to us for grief. So that's the biopsychosocial spiritual based on my training as a hospice social worker of 8 years. People can come to us for anxiety, depression, all kinds of things. We do somatic therapy, parts work, shadow work. So this video and the next one are going to focus on the factors of grief that we assess for. I'm gonna list them in no particular order, and then in the next video I'll give a little more detail about them. Okay, so certainly the age of the person, the griever, the client who's coming to us, and the age of the person who died. The relationship between them, and the quality of the relationship. And I'll go through the difference between those two. How the client, the griever, perceived the death. Was it traumatic? Was it peaceful? Were they there? Were they not there? So we go through all of that. How long ago the person died. If it's been 12 months or more, we do listen for and assess for prolonged grief disorder. This is not pathologizing, okay? Big topic. I'm going to talk about that in another video. But that is one of the things. How long has it been since the person died? And complex feelings, blame, shame, guilt, resentment. Again, could be prolonged grief disorder, maybe not, but we will listen and assess for these things, okay? So in the next video, I'm gonna give a little more detail. Thank you for listening. Again, this is part of trying to welcome people in and just give people an idea so that you can feel comfortable with us. Thank you for listening.